This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. LaFredo, and this week I'm coming to you from KRMC Radiology. My guest is Dr. Kale Bodily. He's a radiologist here. Dr. Bodily, welcome to the program.
Thank you. Good to be here.
Thank you. Good to be here with you. This week on the program, we're talking about your work at High Desert Vein Center, which is a service of KRMC. And in particular, we're talking about varicose veins. They are, as a sort of a basic definition, they are swollen bluish vessels that occur just under the skin, and we usually see them in the legs and feet. What do we need to know about varicose veins?
Sure. So varicose veins are, first, very common. Most people will experience varicose veins or know somebody who has varicose veins over the course of their life. We tend to accumulate them as we get older, but for some people, they can develop very early in life as well, early in adulthood. Here's really the concepts you need to understand, and it's relatively simple. Blood leaves our heart and travels out to our body through arteries. It has to get back to the heart, and it does so, traveling through veins. Because we are upright creatures that walk on two legs, the blood that leaves our heart and goes through arteries down into our feet has to take a long journey uphill to get back to our heart against gravity. Because of that uphill journey, it's a setup for a pressure problem. The pressure on the arterial side is high because it has the pump of the heart behind it. Then it goes through the tissues, through what we call capillary beds, then it has to travel back through veins. And the pressure on the vein side of our body is very low. And so that blood really flows slowly and it trickles slowly. And again, in our feet, it has to go uphill all the way back up to our chest. So gravity is really the cause and really the problem. The way the body tries to solve this problem is in our veins, there's one-way valves. So the blood leaves our toes and goes uphill, and it goes through one-way valves, almost like going through a ladder system where it will jump to the next level and to the next level. And as it goes through a one-way valve that allows it to go up but not slide back down, it can make that progress. When we move around, when we flex our legs, when we stand up, when we walk, anytime we use the muscles in our legs, that blood is assisted. That squeezing helps push the blood up through one-way valves. And because the valves are one way, it can't go back down again. All of that results in good blood flow in the legs. The problem is, over time, those valves can wear out. For some people, those valves wear out because of age and time, and maybe that person has spent a lot of time on their feet. Maybe they worked a job where they were cutting hair or working in a factory and on their feet several hours a day, day after day, week after week, year after year. And over time, constant gravity pulling blood down in the veins can wear those valves out and cause a problem with how it flows. For other people, it's a genetic problem, actually. Some people's genetics predispose them to a valve problem. So their valves wear out earlier or don't work very well from the beginning. So when the valves don't work well, the gravity wins the tug of war and pulls blood down. When blood is flowing down through veins, we end up with a pressure problem. Too much blood pressure in the legs on the vein side, and that causes a disease that we call venous insufficiency. So, long answer to your question about what are varicose veins, but those varicose veins are the consequence of that problem. If we have too much pressure on the vein side of our circulation, little veins get blown up like a circus balloon into big, windy, tortuous veins. They don't work very well, they hurt, they don't look good, and they can lead to other medical problems in the tissues as well. That is something that is quite common in our population. A lot of people have them, and it affects people both cosmetically, but more importantly, symptomatically. A lot of people can have a lot of symptoms because of this disease process.
You described that for some people it's a genetic cause, and for others it may be more about their life experiences. For example, if they worked jobs where they had to stay on their feet a lot. Also, you described that when we're active, and when we're in motion, it tends to keep the blood moving more. Is that correct?
That's right.
With the rise in obesity, we don't want to beat up on anybody, but with the rise in obesity, have varicose veins become more common?
They have. Varicose veins are more common in obesity because obesity does hinder blood flow.
Right.
And so it can contribute or exacerbate the problem.
Right. And of course, connected to that tends to be a more sedentary lifestyle, which is not going to help.
Right. Absolutely.
Understood. We often think of varicose veins as a cosmetic problem, but as you alluded to, they can also cause medical problems. Can we dive into some of those?
Sure. I really think of this primarily as a medical problem, and our goal at High Desert Vein Center is primarily to treat the medical issues. Cosmetic benefits are icing on the cake, really. Patients who have this disease, and this disease again is venous insufficiency, tend to have a lot of symptoms, and the symptoms can be quite severe. Often, the symptoms are under-recognized. People don't realize that the tiredness that they feel in their legs, the heaviness they feel, the early fatigue they feel in their legs is actually from this disease rather than just aging or just being tired in general. And they only really realize that when they've been treated and the symptoms go away. So I named some of the primary symptoms, right? Heaviness, when you have too much blood pooling your legs because the blood's flowing down the vein rather than up the vein like it should. Too much blood in the legs, too much pressure in the legs. The legs are heavy. The legs get tired. People will recognize that they get a little bit of relief if they lay down and elevate their legs. That's a telltale sign that symptoms are occurring because of venous insufficiency. Those symptoms can progress, though, and become more serious. Again, the pressure causes these symptoms, and sometimes people don't even really have varicose veins to speak of. They might not even recognize varicose veins or haven't yet developed varicose veins on the surface of their skin, but the disease is still there causing these symptoms of heaviness, tiredness, and fatigue. If they have the disease long enough, the varicose veins will follow, and that's really what people notice from a cosmetic standpoint, and patients do come to us with concerns about the way their legs look. The varicose veins are not the cause of the problem, they're the result of the problem. And so our primary goal is really to address the problem. How much venous insufficiency is present? In what veins is that venous insufficiency present? Again, secondary to bad valves, and to treat the primary problem. And then turn attention to varicose veins and treat those as well. But in treating the primary disease process, we can stop the development of varicose veins. And as the disease progresses, it goes from symptoms to symptoms with varicose veins that we can see that are uncomfortable and unsightly. And ultimately, the disease can progress to a very severe medical problem where the tissues in the legs, especially down lower in the legs around the ankles, becomes very, very unhealthy. It can be very hard. The skin can be very thick and red or even brown in color. And patients can develop some very, very uncomfortable and very painful ulcers. Venous stasis ulcers are a direct result of this disease process in its severe form. Venous stasis ulcers are miserable. They tend to happen on the inside of the ankles, but they also can happen on the outside of the ankles. It's a consequence of this circulation problem. The tissue isn't healthy, and the tissue starts to break down, or any little injury that it would otherwise heal very quickly in healthy tissues can progress to be this ulcer where the skin is broken down. The ulcer can weep fluid. It's very painful, and it can persist for a very long time. Again, until the disease is treated, that tissue may never heal. So I have had patients who have come to our clinic struggling with these venous stasis ulcers for more than 10 years, who are literally clinically depressed because of the severity of the symptoms and dealing with them day in and day out. Not able to sleep, night and day having pain. The good news is, treating the underlying disease can result in healing of these ulcers. I've seen patients with venous stasis ulcers for more than 10 years watch those ulcers heal within a month after treatment. And that's very gratifying. And those individuals are very, very grateful and pleased to have some relief from those symptoms. And so we really want to, whenever possible, identify this condition as early as possible, treat it as early as possible to prevent the moderate or severe consequences of the disease, because it's harder to treat once it gets to that more advanced state.
I can imagine it would be really gratifying to help a patient who's dealt with 10 years of venous stasis ulcers. It's also heartbreaking to think about, like, what when they got better a month after, having been treated. What's the story? That in those cases they just had no idea that the treatment existed, or how does that work?
I think that's right. Even though varicose veins are very common, I don't think we understand them very well as a society, or maybe even there's some misconceptions. Another part of the problem is that the way varicose veins used to be treated was difficult, invasive, and painful. And so some patients don't understand where the disease is coming from or what it is, and so they don't seek treatment. For others, they have horror stories of family members back in the day that went into the hospital and had to have big surgeries, vein stripping procedures that were relatively barbaric and invasive with old technology, where they'd have to stay in the hospital for several days and have a lot of scarring and big incisions, and that was a high price to pay for treating this disease. So it's important for people to realize that the technology has come a long way. This is a medical disease. It causes real symptoms that can progress to real serious long-term problems. And we now have technology that's been around for 15 or so years. It's tested and proven. We have good experience using it through endovascular approach, putting small little devices on the end of catheters into the veins and using lasers to treat these veins with very little harm or pain or damage to the tissue. We can do these through tiny little incisions, and it's very relatively easy for the patient to have this procedure done. And so I see sometimes patients who have suffered for a long period of time worried about what treatment might entail. And usually the only regret they have when their veins are treated is that they didn't do it sooner, because the procedure is so much easier than they realized. So when we use laser, for example, to treat venous insufficiency in the greater or lesser saphenous veins, which is the most common manifestation of this disease, it's an outpatient procedure. It can be done with local anesthetic only, or it can be done with some IV sedation if the patient would like to do so, to make it even more comfortable and easy. But that patient's able to come into the hospital, have the procedure done, and get up and walk out same day on their own legs and go back to work and go back to doing the things that they love to do and need to do every day. And so there's very little disruption or interruption to a patient's life. And so that's also a wonderful part of this technology that we have, is that we can treat patients without too much pain and without too much interruption to what they're doing.
If you're just joining us, this is Focus on Your Health. I'm TG LaFredo, and this week on the program, my guest is Dr. Kale Bodily. He's a radiologist at High Desert Vein Center, a service of KRMC, and we're talking specifically about his work in helping patients with varicose veins. It's more than just an aesthetic condition. Dr. Bodily, I want to focus in on some of those treatments. First, I want to ask, though, a couple of questions that came out of our conversation. When you talk about ulcers, especially in the lower extremities, I can't help but think about diabetic patients and how common those are. They have foot ulcers. That's a known problem for that population. Do you see some overlap with them, with the sort of ulcerative problems they have and venous insufficiency? Is that all overlap there?
Great question. There is overlap. So any other disease that causes problems with circulation can overlap with venous insufficiency. So the most common ones being diabetes and peripheral arterial disease. So that disease that causes calcified plaques in our arteries, that disease that causes strokes and heart attacks, can also cause bad circulation in the arteries of our legs. Diabetes causes bad circulation in the smaller arteries of our tissues, more in the ankles and the feet, that can cause diabetic ulcers. So these two diseases that affect the arteries can overlap with a vein. Neither of those diseases cause venous insufficiency, but in a patient who has both, the problem gets exacerbated and really magnified. So we do have patients who come in with venous insufficiency and its manifestations and symptoms, and they're suffering even more because they have diabetes.
I have a little list of some of the procedures you do. I could get out of my depth here, so I trust that you're going to help me, but let's talk a little bit about venous ablation.
Venous ablation is the one that I referred to. It's the workhorse, so to speak, of our treatment method at High Desert Vein Center. Venous ablation is a proven method that we've been using for about 15 years, where a laser is introduced into a vein through a very small incision. And that vein that we're targeting is a vein that has bad valves that we referred to earlier in this conversation, where the blood's flowing the wrong direction. And patients used to be treated with venous stripping, where the entire vein was yanked out in a very invasive and difficult and painful procedure. But now we can accomplish the same thing by closing the vein with a laser. And we do that. Imagine a zipper on the inside of a vein being closed so that the blood is no longer flowing in the wrong direction in that vein. Patients often ask, well, what about blood flow? Now that you've closed that vein, how does my blood flow? Remember, the blood's flowing the wrong direction in that vein already, so that vein is not doing you any good. There's several other veins in the leg. We always make sure that we leave plenty of pathways open. Good, healthy veins where the blood's flowing the correct direction. We just target the ones where there's a disease present and the blood's flowing the wrong direction, so there's no downside. We can close the vein on the inside using a laser, and that's venous ablation. And that is, again, the workhorse of what we do. We also offer and commonly use a few other techniques together with venous ablation. So the next common technique is something called sclerotherapy. Sclerotherapy is a simple procedure where we, again, under imaging guidance, and we use imaging guidance. That's why I do this as a radiologist, using ultrasound and sometimes x-rays to be able to look inside the body and do this without making big incisions. But using ultrasound, we can put needles into little veins and inject a special medication. We use a medication called polydocanol. It's a foam. It goes inside the vein and it coats the vein, and it causes the same result as a laser does in veins that maybe we are not big enough for the laser. And it causes the irritation on the inside of this particular vein, and that vein then closes over the course of a few days or weeks, accomplishing the same thing. It stops blood flowing the wrong direction. Some patients have developed, as we referred to earlier, varicose veins, the big, serpiginous, painful, colorful veins on the surface of their legs as a consequence of having this disease for a long period of time. So in a patient who comes in with venous insufficiency and really big, prominent varicose veins, we might treat the underlying cause with the laser, doing venous ablation. We might treat some of the little spider veins or small varicose veins with sclerotherapy, where we inject this medication. But for the big varicose veins, we'll do something called ambulatory phlebectomy. And this is a procedure where we make some very small incisions, so small that no stitches are needed, and we use a very fine instrument to reach in and remove small sections of these varicose veins. It's tolerated very well. Patients really don't complain much at all. We numb the tissues very well. It's not painful. It collapses and is absorbed by the body. And those unsightly and painful varicose veins are essentially removed and disappear. We use that technique, ambulatory phlebectomy, some of the time when necessary. And these are always conversations we have directly with patients. Our approach, of course, is to partner with patients, tell them what we know in terms of what we're finding from their diagnostic tests, explain the results of the testing, make recommendations about what options exist for treatment, and then compare those options with the patient's goals so that we can partner together and find the best treatment plan to accomplish what they'd like to accomplish.
Are these treatments permanent, or is it likely that the patients will have to come back for subsequent visits?
These treatments usually address the majority of the problem, but people who develop varicose veins, especially those who develop them early in life because of a genetic predisposition, I usually tell those patients that you're probably going to develop some varicose veins again in the future. Usually not as severe or as extensive, but you'll probably have some. People who grow varicose veins young tend to grow more later in life. Mm-hmm. While we've treated the major contributors, there might be some minor issues pop up in the future. And so I tell patients that it's not unusual to have a little tune-up every 5 to 10 years.
Okay.
But it's relatively rare.
We've covered how varicose veins are the symptom of a medical problem, not just cosmetic, but often we think of them as a major cosmetic problem. I guess what I'm asking, I hope in a sensitive way, is it more common for women to come in for treatment, or do you also have a fair number of male patients?
Venous insufficiency is a little more common in women than it is in men, but it's still quite common in men. We do see more patients coming in who are female, and I think there is maybe a little more of a comfort level for women to come in and address, especially if they have a cosmetic concern, and be open about addressing that. I would say we probably do have more male patients who have suffered with the disease, have toughed it out, so to speak, mm-hmm. because it doesn't look good, but they don't care quite as much about how it looks. And it hurts, but they're trying to be tough and not complain.
We see this with men in all areas of medicine, right? Like
potentially.
Guys, just go get it taken care of. It means a longer life and a better quality of life.
And again, it's often, I think, just maybe a lack of understanding that there is a relatively easy and a very effective way to address the issue.
Sure.
So there's nothing to be ashamed or embarrassed about. If you're having symptoms in your legs, if you have varicose veins that are bothering you, again, it's for the most part a medical issue. The cosmetic piece is really the secondary issue. Let's make sure your tissues are healthy. Let's make sure your circulation is good so you can stay healthy, stay active, and enjoy the things that you enjoy doing.
Dr. Bodily, how do patients come to you? Is it just by referral, or, for example, if someone's listening and saying, "Oh, I need help with this now," can somebody just call your clinic? What's the best way to follow through on that?
All of the above. So we do have often patients referred to us by their primary care providers who recognize evidence of venous insufficiency and know that we can help them. But if you're out there and you have this problem, or you think you might have this problem, you can stop in or call the clinic, High Desert Vein Clinic, and schedule an appointment. Some people have insurance that requires a referral, but that's less and less common nowadays.
Okay.
And if that's the case, we can help work through that. So there's no reason to have to make multiple appointments. If you think you need to be evaluated for your veins, just make an appointment, come in and get checked out.
Dr. Bodily, in the moment we have left, what is the take-home message from this conversation today?
Varicose veins are common. The disease that causes it, venous insufficiency, is very common. Know that it's treatable. Know that there's good options to have it taken care of. Know that it's a medical problem more so than a cosmetic problem, and so it's worth addressing. If you have any questions about the circulation, especially in your legs, whether it's in the arteries or the veins, come in and see us, and we can help sort that out, give you options that will improve your circulation, keep your tissues healthy, and help you stay active and help you enjoy the things that you enjoy doing.
That is Dr. Kale Bodily. He is a radiologist at High Desert Vein Center at KRMC. For more information, you can reach his clinic at 928-681-8755. That's 681-8755. Dr. Bodily, thank you so much for your time today.
Thank you. It's been a pleasure.
And that is the program. That's Focus on Your Health. I'm TG LaFredo. Thank you for listening. Stay healthy, and we'll catch you next time.